The question for today is, should airline pilots receive periodic mental examinations? The reason why they would need them could be from trauma from past events, such as the 9/11 attacks in 2001, or personal trauma from the past. There needs to be some program or procedure to prevent illness taking effect while in the air. To understand, we must know what causes the mental illnesses in the pilots in the first place. There are many reasons that contribute to the mental illnesses of airline pilots. For example, the traumas from the 9/11 attacks. According to Schuster, although studies of prior disasters suggest that stress reactions diminish over time in the vast majority of people who have had indirect exposure, the September 11th attacks, the shocking televised images, and the profound ramifications are unprecedented. It remains to be seen whether stress reactions in people throughout the country will indeed diminish, especially with recurrent triggers from ongoing threats and further attacks. Another reason is that environmental challenges such as shift work and long hours can cause jet lag among the aircrew. According to Harrington, overall, it seems that although working abnormal hours is difficult to avoid in some industries, work scheduling such as rapid forward rotating shifts, spells of 3 or 4 days on each shift with morning, afternoon, evening sequence, is less disruptive than other options. Now we need to figure out, how do these factors affect the minds of pilots? We need to ask ourselves, what can go wrong if pilots are mentally unstable? One of the things that can happen is pilots can have mental breakdowns while the plane is in the air, meaning the pilot, the co-pilots, the passengers, and the flight attendants are all in danger. One example is the JetBlue pilot that had a mental breakdown last year in 2012. He had a mental breakdown as soon as one of his co-pilots locked him out of the cockpit. According to Haskell, the unruly pilot then went to the cockpit and started pounding on the door. The passenger heard someone yelling "bomb" and "we're going down." This is a prime example of something that can go wrong when mental evaluations are not put upon airline pilots on a regular basis. Another example is that it could also affect the way that the co-pilots, the flight attendants, and the passengers communicate with the pilot. It's important for the passengers to feel safe while flying in the air. Also, flight attendants should have a clear understanding of safety from the pilots and should feel safe as well. It affects everyone on the plane and could also affect the flight attendants too. In fact, according to Baskus, an American Airlines flight attendant reportedly was subdued by passengers this morning after publicly ranting over the PA system that there was a mechanical problem aboard the plane and that it was going to crash. Afterwards, she proceeded to yell out, "Say your prayers," and "we're going down," things such as that. This was a failure of communication between the flight attendants, the passengers, and the pilot, who should have total control over his or her airplane. Here you will see footage of the JetBlue pilot proceeding to have a mental breakdown. There are certain ways and procedures to conduct these mental evaluations upon the airline pilots. One of the ways is mental evaluations should be done annually or biannually, meaning either once or twice a year. Another way to convince the pilots is that it should be covered by their insurance, meaning that they wouldn't have to pay out of pocket, meaning that they wouldn't lose their jobs. Another way is that spouses and family should be involved in these mental evaluations. And according to Robert Bohr, high levels of responsibility for maneuvering aircraft, transporting other crew and passengers, coping with demands and decisions, all require mental capability, excellent health, and emotional stability. The purpose of having regular medical assessments in the aviation industry is to preserve the safety of airline passengers, crew, and those on the ground. Therefore, in conclusion, airline pilots should not be treated like mental hospital patients, but with the past events that I mentioned beforehand, it is important to make sure that passengers upon the airplanes are safe. Pilots should also be taught good habits and techniques to keep themselves physically and mentally healthy, and mental evaluations could potentially cause pilots to lose their jobs in a small amount of cases, but it could also potentially save hundreds and even thousands of lives of the people on board and the people on the ground.